Welcome to LATAM MedTech Insights. Today we are exploring the complex but rewarding market for anesthesia machines and equipment in Latin America. This region presents a story of contrasts. On one hand, major private hospitals in cities like Sao Paulo, Mexico City, and Bogotá are demanding state-of-the-art anesthesia workstations with integrated multi-parameter monitoring and low-flow capabilities. On the other hand, the vast public healthcare sector, the largest purchaser in the region, prioritizes robustness, ease of maintenance, and most importantly, cost-effectiveness. This creates opportunities for both premium and value segment manufacturers. But navigating the entry is far from simple. The biggest challenge is the fragmented and stringent regulatory landscape. Let's consider Brazil, the largest market. Anesthesia machines are typically classified as high-risk Class 3 devices by ANVISA, the national regulatory agency. This classification mandates a full registro submission process. This isn't just a paperwork exercise. It requires a comprehensive technical dossier, often including local testing and, crucially, a Brazilian Good Manufacturing Practice, or BGMP, certification for the manufacturing facility. A real-world example is a German company that faced a 3-year delay simply because the BGMP audit backlog prevented them from getting inspectors to their European plant in a timely manner. These delays are common and can derail an entire market entry strategy. Now let's look at Mexico, another key market. The regulatory body, COFEPRIS, has its own unique requirements. While approvals from reference countries like the US or Canada can facilitate the process, they do not guarantee a swift approval. A common pitfall for companies is the requirement for a local registration holder who is legally responsible for the product in Mexico. All technical and legal documentation must also be meticulously translated into Spanish by a certified translator. We saw a case where a US startup submission was rejected multiple times due to minor translation inaccuracies in the technical file, costing them nearly a year and thousands in resubmission fees. Beyond these giants, countries like Colombia, Argentina, and Peru each has their own specific decrees and import requirements. For instance, some may require a certificate of free sale from the country of origin, while others have specific labeling and user manual language requirements. A successful strategy doesn't treat Latin America as a single block. It involves a detailed, country-by-country approach that anticipates these nuances. The key is understanding that market access is not just about product quality, but about deep regulatory intelligence and flawless execution. The opportunity in Latin America is significant for companies with the right product and the right strategy. The demand for safer and more efficient anesthesia delivery is growing steadily across the continent. However, success is ultimately determined by your ability to navigate the complex regulatory maze efficiently. To learn more about how to de-risk your expansion into Latin America and accelerate your product registration timeline, feel free to email or visit Chen-Global.